Hi, it may have come as a surprise to hear that the drug that is used to treat obsessive compulsive disorder is being considered as a treatment for COVID-19 patients. Fluvoxamine has been shown in more than one study to be beneficial in select groups of patients with COVID-19. In order for us to familiarize ourselves with how the drug does this, it is necessary for us to first examine the way in which the virus damages the tissues and the organs in the body. The coronavirus carries a spike protein on the surface, and that, by the way, is the reason the virus is called a coronavirus, because the spikes on the surface gives the virus this crown-like shape. And that same spike protein is also the most immunogenic part of the virus, in that this is the part of the virus that most intensely stimulates the immune system. Once the virus binds to the surface using this spike protein, it binds to a special receptor called an ACE2 receptor on the surface of the cell. It can then penetrate the cell, and in the cell, it triggers a response of the immune system, which leads to the production of cytokines and chemokines. Cytokines are messengers that signal the cell to perform a specific task. Chemokines are special types of cytokines that attract cells to the sites of injury and infection to perform their task of fighting the virus or the bacterium that has entered the body. And now cytokines are produced by a variety of cells in the body, but the most important sources in patients with COVID-19 are the monocytes and macrophages that accumulate at the sites of inflammation in the body. The high numbers of these cells leads to a high level of inflammatory cytokines like interleukin 6, interleukin 1, tumor necrosis factor, interleukin 8, so that levels of these inflammatory cytokines are found in tissue that is being attacked by the infectious process in COVID-19. Sometimes this process runs out of control, and what we have is a cytokine storm. During the cytokine storm, clots form throughout the body and multiple organs are damaged. Eventually, this can lead to death. Once this cascade begins, it is no longer enough to treat patients with antiviral agents, and anti-inflammatory agents must be used. For this reason, several anti-inflammatory agents have been tried in the past for the treatment of COVID-19. And today, dexamethasone, which is a steroid, an anti-inflammatory steroid, is recommended for the treatment of patients with serious COVID-19 infections in the hospital setting. Outside of the hospital setting, 3 monoclonal antibodies have been given emergency use authorization for the treatment of adults and children over the age of 12 recently diagnosed with COVID-19 who are at risk of progression of their disease and eventual hospitalization. Monoclonal antibodies are expensive, and the treatment is not available widely across the globe. Fluvoxamine, therefore, would be an affordable alternative to monoclonal antibodies. Fluvoxamine belongs to a group of antidepressants known as the SSRI, and more than one members of this group have been shown to have anti-inflammatory properties. A recent study in Brazil has shown that when fluvoxamine is given to COVID-19 patients before hospitalization who are at risk of progression of their disease, the need for hospitalization is significantly decreased. How the drug does this, we still don't know, but several suggestions have been made. It has been suggested that the drug may decrease clotting of platelets in the blood, it may increase melatonin in the blood, or it may even have a direct antiviral effect. A fourth suggestion is that the drug may be working in a fashion similar to the way steroids work in COVID-19 patients. in that the anti-inflammatory properties of the drug may be decreasing the need for hospitalization in this select group of patients. Fluvoxamine interacts with the sigma-1 receptor in the endoplasmic reticulum of the cell. The endoplasmic reticulum is a part of the cell that produces proteins and other substances that the cell needs. It is also a powerful controller of chemokines and cytokines. And in this way, it is able to control the immune response and the way immune cells interact with bacteria and viruses and other injuries. The sigma-1 receptor exerts its influence by acting through the inositol requiring enzyme 1. So that when fluvoxamine interacts with the sigma-1 receptor, that in turn acts on the inositol requiring enzyme 1, which decreases the production of chemokines and cytokines, and in so doing decreases the amount of inflammation. Whether or not this is the way fluvoxamine works in decreasing the need for hospitalization in high-risk patients with COVID-19, we still are not certain. However, the fact that anti-inflammatory drugs such as the steroids have been shown to be efficacious in the management of COVID-19 seems to suggest that this may be one of the ways in which fluvoxamine decreases the need for hospitalization in this specific group. I hope you found this talk useful. If you did, feel free to like, share, and comment in the section below. And don't forget to subscribe and hit the notification bell so that you can get notifications of new videos with useful tips on healthy living. Thanks for watching.